Hi there, I'm Stacy Coventry, and I will be presenting on the benefits and challenges of incorporating animal-assisted interventions with canines in a healthcare setting. Over the last weeks in our coursework, through our text and the peer-reviewed research articles, we are learning and discovering that it is really an exciting time to be part of the animal-assisted intervention field, or AAI, especially to be exploring the potentiality of incorporating these interactions into our scope of practice. Some of those benefits that are particularly appealing in a healthcare environment across all populations of patients, their families, our providers and staff, as well as our community partners, are cardiovascular benefits, seeing reduced blood pressure, providing stress relief and psychological and cognitive benefits, improving social interactions and verbal communication, easing anxiety, improving mood, and facilitating increased mobility, as well as decreasing loneliness and ameliorating cognitive and behavior dissonance. But with all those benefits also come challenges. Here I've incorporated the infographic that we created a few weeks ago for our 5 domains of animal welfare. I'm always thinking about during my volunteer work with CODA and as I'm also working with our community volunteers about how to optimize the welfare of our animals in our program, making sure the interactions with the people and the environment as well as their own health are always prioritized. One of the biggest challenges I see is the lack of national standards for AAI and policies. This is particularly important in a hospital setting that is highly regulated, where I am being asked to not only expand our programming within our hospital, but also across our entire system, which includes 13 member organizations. That lack of consistency really makes it difficult when we're looking at highly regulated environments, as well as reducing risk in terms of liability. Another challenge is that there's not enough training for the handlers and program managers around identifying appropriate dogs for the program beyond just obedience and temperament. We want to make sure our dogs are enjoying these interactions and not just tolerating. We also want to make sure that we are helping to educate on the language in AAI that's always evolving and making sure people clearly understand the difference between AAA, which is animal assisted activities, versus education versus therapeutic interventions. We also have to be aware of zoonosis, and that goes both ways, making sure that our dogs aren't bringing any disease into vulnerable environments where we have populations that are immunocompromised, and it's usually there's a lot of sterile areas that they need to be restricted from. But also we want to make sure that our dogs are safe around the equipment and any toxic materials that might be found. We always need to be sure that we're balancing the human benefit with the animal's welfare. And in doing that, both before, during, and after AAI, I have found that I really align with the positive reinforcement training model that we learned about in our operant conditioning mini lecture this week. Operant conditioning is defined as a method of learning that uses reward and punishment to modify behavior. CODA is a very sensitive dog and really thrives with positive reinforcement, whether reward by treat or praise or an activity that he really enjoys. Not only did we incorporate this when he was learning basic obedience and socializing, but we also reinforce it during his visits. He's consistently looking to me for support and reassurance to almost ask, am I doing the right thing? Am I doing a good job? So I always carry some treats or have some praise right in the back pocket to offer him and reassure him and tell him, good boy, you're doing a good job, so that we continue to see those desirable behaviors and reinforce that conditioning. Just wanted to include a brief video of CODA rounding in the hospital. So this is animal-assisted activities in action. We started a program during the pandemic called Code CODA, where staff could call a Code CODA requesting a visit for staff to help with burnout, compassion fatigue, and boost morale. Up to this point, we had a very active visiting program for patients, whether it was through physical therapy and occupational therapy, helping them learn fine motor skills or verbal communication, or just social visits and helping alleviate some loneliness and providing companionship. But CODA really wasn't thriving in patient visits. He showed a lot of stress. The unpredictability of the rooms and environment and the equipment and noises made him more anxious. These visits created an opportunity where the staff would be able to benefit from some animal-assisted activity intervention, but also be able to give CODA an opportunity to thrive and match him in an activity that he was more suited for. So in conclusion, as the field of AI continues to gain recognition and respect, there's still a need to continue peer-reviewed research in order to create consistency. It also would be helpful to identify the fields where it has the greatest opportunity to provide benefit, as well as establishing guidelines for temperament or aptitude, along with training for varying species. Educating practitioners and humans partnering with animals is also needed, and developing a clear standard for ethical and safe practice when applying AAI across different fields and populations for both humans and animals. Thank you so much.